Welcome to the PubMed Daily Review for March 31st. Today we scanned 403 new open access papers. Here are the top 5 selected for detailed analysis. Trend 1 of 5, medical dosimetry and clinical outcomes. This trend connects medical measurements and interventions to their real-world patient health results. This cluster covers 51 papers. Representative work includes independent verification of vendor-issued dosimetric data for 106. Brachytherapy using diode detectors with traceability to external beam standards for absorbed dose to water. B-mode ultrasonographic evaluation and reference dimensions of the liver and spleen in healthy lactating sonogoats. And pulp transplantation in necrotic mature teeth with periapical radiolucency. Trend 2 of 5. Catalysis and molecular transformations. This trend explores how catalysts and molecular transformations drive chemical reactions and biological processes. This cluster covers 135 papers. Representative work includes a tissue-resolved, network-based transcriptomic framework for abiotic stress responses in sorghum, identification and characterization of BHD hydroxycinnamyl transferases in the fern Neoblechnum brasiliensis, an efficient and durable photochemical CO2 reduction by TO2, immobilized metal porphyrin catalysts. Trend 3 of 5, orthopedic surgery and biomaterials. These papers investigate advancements and outcomes in orthopedic surgery, focusing on patient factors, novel technologies, and biomaterial applications. This cluster covers 44 papers. Representative work includes risk factors in elderly female patients for refracture within 2 years following surgery for fragility fractures, a prospective observational study. Artificial intelligence in orthopedic trauma surgery, a scoping review of current applications and research gaps, and comparative evaluation of additively manufactured PLA models as cost-effective, non-inferior alternatives to composite bones for pull-out testing. Trend 4 of 5, health, lifestyle, and stroke. These papers explore how physical, environmental, and neurological factors influence health outcomes and disease progression. This cluster covers 95 papers. Representative work includes physical activity, sedentary time, and obesity in adolescents. Differences by school grade. Relationship between prevalence and severity of exercise-induced pulmonary hemorrhage and environmental factors, and effectiveness and safety of endovascular therapy compared to intravenous thrombolysis in acute ischemic stroke due to medium vessel occlusions. A real-world multi-center study from the Italian SITS registry. Trend 5 of 5, veterinary and clinical medicine. These papers explore therapeutic interventions and diagnostic approaches across human and animal clinical medicine. This cluster covers 78 papers. Representative work includes caudal esophageal achalasia in a quarter horse colt, associations of corticosteroid therapy with weight change and appetite in patients with advanced pancreatic cancer, a post-hoc analysis from the Mistral trial, and 24-hour Holter electrocardiography in the evaluation of French bulldogs before and after rhinoplasty and staphylectomy procedures for correction of anatomical abnormalities of brachycephalic syndrome. Up next, our first paper out of 5. Activation of epigenetic reprogramming via crotonylation overcomes resistance to EGFR-TKI therapy in lung cancer by Si-Hong Chun and Lihui Wang from A Department of Pharmacology, School of Life Science and Biopharmaceutics, Shenyang Pharmaceutical University, Shenyang, 110016, People's Republic of China. Let's break down its key contributions. Lung cancer patients often develop resistance to targeted therapies like EGFR-TKIs. While we know epigenetic changes play a role, the specific mechanisms involving newer histone modifications, such as crotonylation, are still being uncovered. This study delves into how crotonylation might be a key player in overcoming this therapy resistance. To understand this resistance, the researchers focused on a specific histone modification called crotonylation, particularly on H3K56. They found that in EGFR-TKI-resistant lung cancer cells, this modification was reduced. This reduction was linked to the suppression of a gene called HNF1A, which in turn activated a signaling pathway known to promote cancer growth. The study clearly showed that lower levels of H3K56 crotonylation were a hallmark of EGFR-TKI resistance, leading to the silencing of HNF1A and subsequent activation of the PI3K/AKT pathway. Excitingly, When they used an inhibitor to block the removal of crotonylation, they were able to restore histone crotonylation levels and significantly improve the response to EGFR-TKI therapy. This research highlights histone crotonylation as a critical factor in lung cancer's response to targeted therapy. Targeting this epigenetic modification, perhaps with decrotonylase inhibitors, offers a promising new avenue to overcome treatment resistance. Future studies will likely explore the clinical utility of these inhibitors in combination with EGFR-TKIs. Up next, our second paper out of 5, Engineered Exosomes for Targeted Glioma Therapy. Overcoming the blood-brain barrier with nature-inspired nanocarriers by Param Rahmani and Reza Akhavan-Sigri from Pharmacy, Tehran University of Medical Sciences, Tehran, Iran. Let's break down its key contributions. Gliomas, especially glioblastoma, are among the deadliest primary brain tumors. A major hurdle in treating them is the blood-brain barrier, which severely limits how much medication can reach the tumor. Current treatments offer only modest survival benefits. This has led researchers to explore nanotechnology as a way to improve drug delivery across this formidable barrier. This review focuses on engineered exosomes as a novel approach for glioma therapy. Exosomes are natural nanocarriers secreted by cells that can inherently cross the blood-brain barrier. Researchers are exploring various techniques to engineer these exosomes, load them with therapeutic agents, and improve their isolation and purification. The key idea is to leverage their natural ability to bypass the BBB and target tumor cells. Exosomes, typically ranging from 30 to 200 nanometers, possess a remarkable natural ability to cross the blood-brain barrier. This characteristic makes them highly attractive for delivering drugs directly to brain tumors. Furthermore, they can be engineered to carry therapeutic payloads, modulate the tumor microenvironment, and even act as theranostic agents for combined treatment and diagnosis. They also hold potential as a source for identifying biomarkers of glioma progression. In conclusion, engineered exosomes represent a significant advancement in precision medicine for glioma therapy. Their ability to naturally cross the blood-brain barrier and their inherent biocompatibility make them a compelling alternative to synthetic nanocarriers. While promising, more clinical research is needed to translate this potential into effective patient treatments. Future work will likely focus on optimizing exosome engineering for even greater therapeutic efficacy. Up next, our third paper out of 5, The New Era of Precision Oncology. Practicing Pathology in Low-Resource Countries and Settings by Zubair Ahmad and Jamshid Abdul Ghaffar from Department of Pathology, Sultan Qaboos Comprehensive Cancer Care and Research Center, Muscat, Oman. Let's break down its key contributions. The future of cancer treatment is here. It's personalized. Precision oncology uses a patient's unique molecular profile to guide therapy, marking a significant leap forward. This revolution places pathology at the very center of cancer care, demanding new skills and technologies. Today, we'll explore the opportunities and challenges for pathologists, particularly those working in low-resource settings, as they navigate this exciting new era. This paper takes a comprehensive look at the evolving role of pathology in the age of precision oncology. It examines key technological advancements like next-generation sequencing and artificial intelligence. The focus is on how these tools are reshaping cancer diagnosis and treatment, and the specific implications for pathologists, especially those practicing in areas with limited resources. The paper highlights that molecular biomarkers are now critical for guiding cancer therapy. Technologies like next-generation sequencing and comprehensive genome profiling are becoming the foundation for personalized treatment. Digital pathology and AI are also emerging as powerful tools to improve diagnostic accuracy and speed. However, significant challenges remain, particularly in low-resource settings, including the need for infrastructure, sustainable funding, and skilled personnel. The key takeaway is that pathologists are indispensable in the era of precision oncology, but they must adapt. Embracing new technologies like NGS and AI is not optional. It's essential for providing optimal patient care. For global health equity, we must prioritize solutions that overcome the unique challenges faced in low-resource settings. Continued innovation and collaboration are vital to ensure all patients benefit from the advances in cancer treatment. Up next, our fourth paper out of 5, Predicting Childhood Anemia in Ghana with Explainable Machine Learning. A national survey analysis by Yahya Sheikh Abdul Hassan and Mohammed Mustaf Ahmed from Faculty of Medicine and Health Sciences for 72894 Jamhuriya University of Science and Technology, Mogadishu, Somalia. Let's break down its key contributions. Childhood anemia remains a critical public health challenge, particularly in low and middle-income countries like Ghana. It significantly impacts cognitive and physical development, threatening long-term human capital. Despite ongoing interventions, progress has been slow, highlighting a need for more sophisticated methods to identify at-risk children and understand the complex interplay of factors contributing to this condition. This study analyzed data from the 2022 Ghana Demographic and Health Survey, focusing on children aged 6 to 59 months. Researchers used a nationally representative sample of over 3,300 children. They investigated 21 different factors, including child's age, malaria status, maternal anemia, and household wealth, to predict anemia. 6 machine learning models were compared against traditional logistic regression to see which performed best. The study found that nearly half of the children surveyed had anemia. Among the machine learning models, gradient boosting achieved the highest discrimination with an AUC of 0.72. However, support vector machine and logistic regression models were better at identifying actual cases of anemia, with sensitivities around 72%. Key factors consistently identified as important predictors included the child's age, malaria status, maternal anemia, region, and household wealth. This research demonstrates that machine learning holds promise for improving the prediction of childhood anemia in Ghana. While models like gradient boosting offer good overall discrimination, those with higher sensitivity are more practical for screening, though they are not perfect. The identified predictors highlight the importance of addressing malaria, maternal health, and socioeconomic factors. These insights can guide more precise, targeted public health strategies to combat childhood anemia. Up next, our 5th paper out of 5. Cardiorenal outcomes with tirzepatide compared with dulaglutide in patients with diabetes and cardiovascular disease. A post-hoc analysis of the SURPASS-CVOT randomized clinical trial by Stephen E. Neeson and Stephen J. Nichols from Cleveland Clinic Coordinating Center for Clinical Research, C5 Research, Cleveland Clinic, Cleveland, Ohio. Let's break down its key contributions. Managing diabetes, especially in patients with existing cardiovascular disease, is complex. While incretin therapies like GLP-1 agonists have proven beneficial, new agents like tirzepatide offer a dual mechanism. We wanted to see if this dual action translates to better outcomes beyond just major cardiovascular events, specifically looking at a comprehensive set of cardiorenal issues. This was a post-hoc analysis of the SURPASS-CVOT trial, a large, global, double-blind study. We looked at over 13,000 patients who had both type 2 diabetes and existing cardiovascular disease. They were randomized to receive either tirzepatide or dulaglutide weekly for about 4 years. Our main focus was on a combined endpoint looking at major cardiovascular and kidney events. The results were quite compelling. Patients treated with tirzepatide experienced a significantly lower rate of the primary 6-component cardiorenal endpoint, occurring in 23.7% of patients compared to 27.4% with dulaglutide. This translated to a hazard ratio of 0.84, with a p-value less than 0.001. Importantly, this benefit was seen across multiple components, including a reduction in adverse kidney outcomes. Gastrointestinal side effects were more common with tirzepatide, but overall adverse events leading to discontinuation were similar. This analysis suggests that tirzepatide provides significant benefits for both cardiovascular and kidney health in patients with diabetes and existing cardiovascular disease, going beyond what was seen with the standard GLP-1 agonist dulaglutide. The dual mechanism of action seems to be a key factor. While these findings are promising, we need to consider long-term safety and how these benefits translate into real-world clinical practice and cost-effectiveness.